This is Dr. Rekha Gogi. Greetings from Cloudnine Hospital, Malleshwaram, Bangalore. Today, I am going to talk to you about a very common question which get asked by patients or pregnant women and their families when they visit me at the OPD. Doctor, can I have a vaginal birth after I've had a cesarean section the first time? Most commonly, the families are more interested in the lady having a vaginal birth after cesarean. The woman per se or the pregnant lady per se is okay. So commonly asked because they want to know if repeat cesarean is good for the mother, the baby, or she can manage this delivery through the vagina, not again go through the cesarean. Well, the answer for it is both yes and no. Because if I can say that it is safe, yes, there are certain reasons for whom I would say no straight away. So it depends on two or three things. One is, why did you have a cesarean section in the first time? Secondly, who did it and what was the reason? Where was it done? And how many cesareans have you had? So if your cesarean in the first time was for a reason which was like, say, supposing you had gone into labor and you had gone up to 4, 5, maybe 6 centimeters, and then you just stalled and the delivery and the labor didn't progress, and so the baby's heart went down and the doctor has to perform an emergency cesarean, then the chances that you'll have a normal VBAC, that is vaginal birth after section, is probably better. But if you have been induced and you are not going to labor at all, you did not reach the place where the cervix dilated and then you didn't reach to the full blown active labor, and there was a reason that the baby was too big to come out of the pelvis or the vagina, then the doctor would have said failure of induction, and if that person had done cesarean for that reason, then probably your chances of a vaginal birth are lesser. If you had cesarean section for something like a breech baby, that means the bottom of the baby is down and the head is up, then the chances that we don't know how the second cesarean would work or vaginal. So there must be what is called as TOLAC or TOLAC, trial of labor after C-section for a vaginal birth. So what I would say is, you need a willing mother who's very motivated to have a vaginal birth. You need a willing doctor and you need a hospital which is a tertiary care setup. I mean to say, a safe candidate, a safe hospital, and a very experienced senior doctor is the one who will decide. If you ask my personal recommendation, maybe if you have a good chance of a cesarean, which is 80%, like the reasons I told you, you should try for it in a tertiary setup where a doctor is available round the clock to monitor you. If you had cesarean sections for reasons of cephalopelvic disproportion or failure of labor induction, then I would not recommend it. If you had more than 2 cesareans, then I definitely will not recommend or even do or offer a vaginal birth after C-section. Actually, to tell you the truth, the chances that uterus will rupture and the baby will come out and the placenta will separate, come out through the uterine scar which was done earlier, chances of it are very, very rare, less than 1%. But you never want to take that risk. So if you ask me, the pendulum of VBAC versus repeat section is swaying very, very widely and very drastically. So we don't know unless and until you have been assessed by a good doctor to decide. Talk to your doctor before you take a decision. Thank you.